From Studio 226 in Orlando, this is Aging Smarter. Aging Smarter is a podcast focusing on making it easier for you to grow older and to prepare for the future at any age. We aim to educate, to entertain, to prepare, and to amaze you about your life's journey, regardless of your age. I'm your host, retired and former circuit judge Jose R. Rodriguez. Today we're talking about how to build stronger, smarter communities for our older adults. That would be through education, through connection, and collaboration. Joining me are Dr. Sheila Baez-Torres and community leader Karla Radka. Sheila Baez-Torres joins the K2 medical team as principal investigator. She's a neurologist and a movement disorder specialist with over 12 years of experience in the field. Dr. Baez-Torres' main focus is neurodegenerative diseases. That's a long word. But again, neurodegenerative diseases are her specialty, specifically dementia and Parkinson's. And Karla Radka is the president and CEO of the Senior Resource Alliance, which is responsible for a large number of programs and resource opportunities for the aging and caregiving community. And she is also the recipient of the Don Quixote Award from the Hispanic Chamber of Commerce, which recognizes us as a leader in our community. Welcome. Question, Karla, Dr. Baez-Torres, when you look at the challenges that seniors face in 2025, what stands out the most? Karla, what do you see some of the challenges being?
There are multiple challenges that we see that is really affecting our senior community, not only in our community here in Central Florida, but in the whole country. And one of them that is one that could possibly have easy access for solutions is social isolation. When we're talking about seniors that are living alone or not necessarily just with great connections in the community, we know that that can be a trigger for so many other conditions like depressions and weight gain and anxiety disorders, and trigger for other disorders like dementia and Alzheimer's. So I think that is something that is significant in our community, and what it takes is connection. Yes.
Dr. Baez-Torres, what do you see as some of the challenges for 2025 for our senior community?
You said it perfectly. Isolation. When I see patients, I normally tell them, stay active physically and mentally. And by that, I mean seeing them involving community events, whether it's a bingo or a book club or gathering, dominoes, of course.
Of course.
Anything that they enjoy, or picking a hobby. I never tell them, I never say what to do. I say, pick something that you like. I'm not going to say, play chess. No, because then they do it once because the doctor said so. No, I want something they like, whether it's gardening or playing dominoes. That's a hard game, right? You need to use your mind to get going.
Strategy.
So, the strategy, the emotions of planning your strategy, winning perhaps or not winning this time, but then you correct, right? So you have the mental activity going.
But also, as Karla mentioned, the social isolation is ended. For example, when you're dealing with playing dominoes, cards, or any of those games, you don't just play the game. You engage in what we call the chisme. For those of you who don't know what that just means gossip, just means talking, social interaction. So that is, I think, a challenge and a benefit that I think we can see that our community can get. So how do barriers like transportation, like technology, or the impact of isolation impact older adults in their health and in their independence? Doctor.
I'm going to talk first about health. Certainly in this country, Medicare sets the rules, right, for the health care. And the private insurance follow Medicare, whether it's for the medications that are going to be paid for Medicare and therefore the private insurance companies, or how many physical therapy sessions somebody can have per year.
Right.
And you get them going, interacting, and getting back in shape, and then they run out of sessions. And then they have to sit and wait until the next year kicks in. So this on and off events don't help them. So By that, I mean, let's give them options, choices, where if the insurance is not going to support this, the community will, the church will, the friends, the family will. So they don't depend on the one form of interaction. We all lived COVID, right? We were not prepared for that. And I remember when we were in the lockdown days that roughly within a month or so, there was a common theme. All the caregivers were saying, oh, so-and-so is getting so depressed. So-and-so is falling more. It's not talking as much. So every single patient I took care of, there was a decline in their emotion, in their state of mind, and in their health overall. So we have to have a plan B so it never happens
Karla,
again.
I know that the Senior Resource Alliance supports a number of programs. One of them has to do with balance, and it's not only offered in English, it's also offered in Spanish. Tell us about that, as well as any of the other many programs at the Senior Resource Alliance. I mean, you've got 4 counties, Seminole, Brevard, Orange, Osceola. I think you have to have wheels to be able to touch on all of those counties. But tell us about those programs, how they reach the seniors.
Yeah, we're very fortunate to have an incredible team at Senior Resource Alliance of instructors and coaches who actually teach and facilitate these evidence-based programs. A Matter of Balance is a wonderful program that is all about preventing falls.
Right.
And the important thing that it goes above and beyond just teaching skills, changing behavior, teaching best practices to be able to prevent falls. It also creates a community within the participants of these workshops.
That's true.
Multiple weeks that they see each other, that they spend time together, they encourage each other and push each other to be able to remain healthy, moving, strong, and connected. Other programs that we have, again, another evidence-based program is the living with chronic diseases, and that is especially for individuals that are living with heart disease or diabetes, on how to really modify their behavior and their activities so they can live and manage those conditions that, especially that are so evident in communities of colors. You know, Hispanics have a great incidence of heart attacks, heart disease, and diabetes, and so are African Americans in our communities. We're there for the whole community, and these programs are offered there at no cost with community partners and community centers and gyms and doctors' offices, and along with all of those, my favorite, which is Tai Chi.
Ah, me too. Me too. You've hit a soft spot in my heart. So tell me, what makes connecting seniors to the existing resources just as important as creating new ones?
I think it's important to connect seniors with existing resources because many of the existing resources that we have are our point of entries into our system of care. So it's not necessarily what is the newest, it's what is the basic services. Some of the basic services are the Meals on Wheels programs that we offer.
Yes.
You know, hunger doesn't discriminate.
Nope.
And it's so important to have nutrition because nutrition, again, is a part of healing, a part of remaining strong and active and in good shape. I think that right now, one service that is extremely important because it's open enrollment time is our Shine programs.
Yes, we had them on one of our podcasts.
Exactly. So we just go back and look at that Shine episode to see all the great benefits of Shine, which is unbiased advice on the selection of their Medicare programs.
And free.
And it's at no cost.
Free.
Yes,
My favorite F word, free.
Yes.
So, Dr. Baez-Torres, how can education help older adults and caregivers take charge of their health and well-being?
Awareness to begin with. So to themselves, any changes in their activities of daily living that they realize they're not able to complete as well as they used to. Simple things. You would be surprised, as simple as using the microwave oven that they have used all the time, all of a sudden they don't remember. So that gives you a hint, there's something going on here. Sometimes if it's lack of understanding how the medication work, so they are compliant with their care, right? For example, blood pressure. I always use that example.
Oh, I know that well.
I don't take my blood pressure because my blood pressure is good. Yes, it's good because you're taking your medication. If you don't take it,
If you don't take it, you wind
it
up in the
bounces
hospital,
back,
and
right?
I am living proof of that.
Oh no!
Oh, yes. Unfortunately.
Talking about the connections, going back to that point, hearing. You will never remember. You will never remember what you never heard.
Exactly.
Right? So how simple, and it's so sad because something that simple, first level, will isolate you. You will not engage in the events that you're trying to prepare for them because they can't understand, follow the conversation, so they give up. Same with TV or family events. They start isolating, right? How simple and how important.
Could you put the hearing impaired, the closed captions on? Because I really can't hear. And, they speak in such a British accent that I don't understand what they're saying. And, maybe we need to put the closed caption. Well, it's basically the hearing, I gather. So, Karla, you've given us some examples about programs or partnerships that are really making a difference other than the SHINE program. Oh, my goodness, you've got such a plethora of programs. There you go, some poetic plethora of programs. Tell us a little bit more about what programs the Senior Resource Alliance offers.
Definitely, as a follow-up of individuals that may be forgetful and possibly with early signs of dementia, we have services that it provides support not only to the individual that is living with dementia, but also to the caregivers. And those are at the most basic levels, support at home or daycare services. And in addition to that, our newest program, which is Guide, provide more than $2,500 in care for the individual that is living with dementia, either at home or in a daycare center, so the caregiver can get some respite.
Right.
Yes. And that is so important that take care of our caregivers because that role is, it can be extremely exhausting at times.
Compassion fatigue.
Definitely. So it's important. And our caregivers are individuals that we have a line of services because they're very special for our programs. And we're always very cognizant that without them, we will live in a very different community. But they actually are an incredible safety net for their loved ones, for the community, and I believe it's a labor of love.
Absolutely. It seems that collaboration is the key here. Doctor, how can medical professionals, nonprofits, Karla, and local organizations work better together?
Communication, you just said it. How many times as an investigator running clinical trials, I talk to the relatives, the primary care physicians, and other specialists involved in the care of somebody so they understand what we're trying to do and so they can promote the opportunity of research, but also help the patient, the subject, feel comfortable with the idea of perhaps considering research. I think at every level of care, when I was practicing neurology in the community, same, talking to primary care and other specialists, sending the notes, making sure the loop is closed. So everybody is aware and up to date with what's happening with that individual.
You would agree with that?
I agree 100%. And when we're talking about professionals, especially in the healthcare, but any profession that really serves seniors and caregivers, we offer an incredible program and curriculum to train them on how to recognize the signs of abuse, neglect, and endangerment of seniors. This training actually carries CEUs and a certificate, and that training is available for places of work, professionals, anyone who actually served
even
our
law
seniors.
students.
Of course, even
because
law
the
students.
Senior Resource Alliance made a
Yes.
presentation last semester
Yes.
for my class, my elder law class,
Yes.
which was very well received. I think one of the stunning things that came out of that was that students and even I did not I guess, took for granted that there wasn't a self-care view or position. In other words, self-care was stunning as a reason why folks did not, again, abuse themselves. So that's something that came that was pretty eye-opening. So finally, let me ask, what's one thing that you believe communities can do right now better to support older adults and caregivers, Doctor?
There's so many options, but I want to say something a little different. Start educating the youth, right? So we
Get them while they're young.
Get them when they're young so they understand, they care, and support their grandparents. And as they grow up, they support the community's effort as well.
Even if Grandpa keeps repeating himself over and over again, understand why he's doing that.
And just to enjoy having that grandpa, that grandmother, elderly aunties and uncles, right? It's a blessing to have them, and until they're gone, right? And that's when it's too late. So, and it brings light and joy to their lives, right? And many elderly patients try to keep up with the grandkids that know so much about technology. They want to be involved in their lives, but you have to give them the opportunity. So us as parents have to teach these younger generations, and they need to follow. So nothing is more important than family. So all these efforts sink in place.
It's the intergenerational contact that I think not only profits or benefits the youth, but it also profits the youth in those of us who are aging. So keeps us young, keeps the older folks wanting to live longer to be able to enjoy the grandchildren. And the grandchildren, well, they've got a source of fun and a source of, if nothing else, making fun of Grandpa and the way he rocks his rocking chair.
The
Carla?
best memories.
Exactly.
The best memories
Finally, what do you think, Karla? What's one thing that you believe communities can do better to support older adults and caregivers?
I think that as the holidays are approaching us so quickly, it is important just to make our table bigger, add an extra seat at the table, invite a senior, someone who may live alone, or a couple of seniors that may live by themselves. Invite them for a cup of coffee, for a piece of pie. It's important just to remain connected. We are all intertwined in this ecosystem that we call community, and I think it is very important just to remain engaged. And evidence tells us that grandparents, what you were saying, Dr. Baez, that seniors that are close to their grandchildren live a more fulfillment lives. Kids and teenagers that are close to their grandparents have less anxiety. So it's a great equalizer when it comes to self-regulation for emotions and for daily lives and the challenges that a young person may be facing. So it's important to remember that.
Well,
And
I can tell you that now that I have two grandchildren, I want to take better care of myself because I want to live longer. I want to watch them grow up. It makes sense. It just makes sense. They are. I tell my daughter and son-in-law that their kids are magic. They're magic because their smiles just change the old man.
Those twins have your heart.
They do.
Yes.
They do. So, in closing, Dr. Baez-Torres, Karla, thank you both for joining me. Today's conversations reminds us that aging smarter means working together, working through connection, working through education, and, of course, compassion. This is what builds communities where everyone can thrive. So, folks, you've been listening to Aging Smarter. Thank you for being a part of the conversation. Let's keep learning, let's keep connecting, and let's keep aging smarter. Until next time, we hope that you'll give us a like and that you will subscribe. Remember that these podcasts also appear. You can get them by going through the Senior Resource Alliance website. You also can get them every week as they roll out. And at this time, I think I need to go ahead and be grateful to our showrunner, Emmy-winning Art Miles. Also, our producer, Annie Rodriguez-Newburn, without whose help these two individuals, well, they are absolutely irreplaceable. They are absolutely the soul of Aging Smarter. So keep on aging smarter. Until next time.